It's my pleasure to introduce a professor of pediatrics, a professor of infectious diseases, a professor of epidemiology at Emory, and also the next president of NFID. Walter.
If only my kids had heard that, to at least know what I've been doing all this time away from them. Both of them actually went into medicine, and I've said that I was not home enough to discourage them. Thank you very much. Tonight's program will begin with the presentation of the John P. Utz Leadership Award. This award was established by the NFID Board of Directors in 2007 and is named in honor of Dr. John Utz, who was one of the founders of NFID and a champion of the fight against infectious diseases. To honor his memory and years of dedication to the profession and to NFID, the award is presented to individuals who exemplify and support NFID leadership goals through service to NFID and/or the field of infectious diseases. On behalf of the NFID Board of Directors, it gives me great pleasure to present the 2016 award to my colleague and friend, Dr. Larry Pickering. Unfortunately, I'm not going to have any jokes as we go on with regard to that. I'm going to I have the honor really to explain why Larry deserves the John P. Utz Leadership Award. For those who don't know, Dr. Utz was the first president of the National Foundation for Infectious Diseases and set the stage for the productivity of the organization today. The mission of NFID is focused on educating the public and healthcare professionals about the causes, prevention, and treatment of infectious diseases across the lifespan. And I can think of no better person who has played such a role in reducing the burden of infectious diseases than Larry Pickering. We could spend the entire evening reviewing Larry's CV and contributions. In fact, we could write books about his accomplishments. But I will try and cull out a few of his many, many successes to highlight how much he has done for the world. Perhaps he is best known for editing 5 editions of the American Academy of Pediatrics report of the Committee on Infectious Diseases, better known as the Red Book, between 1997 and 2013. The Red Book is the Bible of infectious disease diagnosis, treatment, and prevention for America's pediatricians and actually physicians around the world. Service has been a cornerstone of Larry's efforts. He is a past president of the Pediatric Infectious Diseases Society, a member of the Board of Directors of the Infectious Diseases Society of America, and has contributed outstanding service to NFID. He served on the Board of Directors of NFID from 1997 to 2012. He was the treasurer from 2003 to 2012, and continues to serve as a co-chair for the clinical vaccinology course since 2001. From 2006 to 2015, Larry was the executive secretary of CDC's Advisory Committee on Immunization Practices, or ACIP, and really transformed the committee. This included developing standard evidence-based processes for making vaccine recommendations, developing a website to transmit key information on the ACIP, its deliberations and its recommendations, and much more. The ACIP is a model not only for immunization policymaking, but also for other types of policymaking in medicine and public health. To ensure that the ACIP recommendations and CDC's morbidity and mortality weekly report remain up to date, Larry instituted a policy of regular review every 3 to 5 years with renewal, revision, or retirement of recommendations as indicated. Also, Larry ushered in the practice of welcoming members of national immunization technical advisory groups, or NITAGs, and ministries of health from countries around the world, and this included India, Japan, China, South Korea, Chile, Peru, Mexico, the Democratic Republic of the Congo, Zimbabwe, Ireland, Saudi Arabia, Turkey, and many others to learn about ACIP's process of developing evidence-based immunization recommendations and gain lessons that could be adapted to their national situations. Finally, Larry has played a key role in mentoring many epidemic intelligence service officers during their 2-year training fellowship at CDC, following which many went on to take leadership positions involving vaccines and immunization in CDC's National Center for Immunization and Respiratory Diseases. While Larry will likely not live forever, sorry Larry and Mimi, his efforts to improve the health of children and adults against infectious diseases has led to many lives saved who will have impact on future generations. And Larry's efforts have resulted in the formation of or strengthening of institutions which will continue to have impact in the future. Many people owe their lives to his work. Thus, in a sense, Larry has achieved immortality, and generation after generation will benefit from his contributions. For all these reasons, NFID is honored to recognize Larry Pickering with the John P. Utz Award. Larry.